Dr. Chul Kim here from sunny San Diego, California. We are getting started. We have the A team working very hard to be color coordinated. We love blue around here. This is a very young 50-year-old who is otherwise very active, roller skating, skiing, running, but she was injured in a car accident. And if you look very closely, she's got 2 disc protrusions with annular tears. They don't look like much, but some annular tears are very, very painful because the injury is self-perpetuating after it occurs. The injury leads to inflammation, and the inflammation becomes chronic. We know that this is a pain generator because we have did a targeted injection at both those levels, and she got marked improvement temporarily, but unfortunately the pain keeps coming back. So we decided to just go in there and get this thing fixed, utilizing the most minimal invasive technique possible. We'll come in here through a little poke hole using the LESS technique, Lumbar Endoscopic Spine Surgery, LESS. It's basically knee arthroscopy in the back. We're going to evacuate and remove any loose pieces, release all the nerves that tend to be stuck down due to chronic inflammation, and start a new healing reaction. And hopefully she can get back to her busy life as soon as possible. So wish me luck. Got the needle in, the tiny one. I'm injecting in the middle of the disc and watching it leak out the back. Shot and save. There it is. Shot and save. Oh, that's a big tear. Look at that. Save that. It's already leaking out. Shot and save. There it is. Shot and save. I love doing this chromatic discogram. Shot and save. Not everyone does that, but I learned how to do it this way, so I can't stop now because it's so helpful. It's an extra step, but I'm all about doing everything possible to maximize our results. It is official. This is my new favorite instrument, the curved articulating ball tip feeler with the ball tip on the end of it. Imagine now that this was slightly longer. So I have a short one and a long one. I'd be unstoppable. Lots of blood vessels. And here's the other reason why I like the blue dye. It's pretty unequivocal. That's going to be the disc. It feels like disc, looks like disc, tastes like disc. I'm glad I didn't step in it. Look at how adherent everything is. That should not be like that. It should be totally free, pulsating and sliding as you straighten your leg out. Oh, she just jumped. Nerves are working. This is one of the hardest part of this surgery. I have to rotate this and sweep the dural tube out of the way. And this just falls in because it is an empty tent. If this was a normal annulus, I would no way be able to fall in like that. There's going to be a big tongue that goes medial. So I'm still very posterior. Goes all the way across, right there. You feel a flap right there. Right there. Look at that little tail right there. Taunting me. Daring me. Alrighty, I got all the stuff. There's the dural tube. It's going to start pulsating. It's totally free and free of injury too. And then everything will just collapse on itself. Look at that, I got the perineurium intact too. That's where all the blood vessels go. And that opening is really small, and then all the muscles are just going to collapse on itself. That's what MIS is about. My other favorite instrument, the curved Pac Man. It's basically a biting meniscal basket. It's much sharper than a kerrison. And it has this very gratifying snapping sound. Probably like It's like when you do a meniscectomy. Except when you do a meniscectomy and you take this bite, it's like you're removing something precious that you can never put back. This is just ligamentum flavum. I'm sure it has a great important role, but not as important as the nerve or the facet joint or all the other structures nearby, so it must go. But this is a tiny little opening, tiny. It just looks big because it's magnified. Everything is stuck. I think that's the disc. I feel it, but Dr. T, I've been thinking about you, wondering how things are going. I'm doing a interlaminar uniportal case. It's a discectomy, but I could easily go biportal if I needed to, but I don't need to. And then look at this empty tent sign. And the blue dye is the chromatic discogram, which I don't think you do, but I still love doing it. Anyway, hope all is well. Hope to see you soon. I'm going to be in LA for the World Congress of Minimally Invasive Spine Surgery and Technology. So if you're there, let's spend some quality time together. All the way back, right off the bat. Can you get some pathology footage? Look at that tear. What's funny is that 5.1 does not look as bad as 4.5, but I bet you 5.1 is a huge pain generator because there's lots of inflammation and this tear is really obvious. It's just full thickness. Oh, lots of loose pieces. Lots. Which begs the question, how much disc should you take out? It's kind of like watering a plant, not too much, not too little. That's one of the hard things about this surgery, knowing when to stop. That's why we call it salt and pepper, because we use it as a pusher. I don't know how I did this surgery without this articulating curette. Jeez. I guess it's like everything. I don't know how I lived without my Claude AI program either. But I did. That would be awesome if you could get it down to 4 instruments. Look at that. It's like a little, I don't know, it's like the tail of an iceberg. This seems worse than 4.5 in some ways. It's a much more delaminating kind of tear at 5.1 than compared to 4.5. But the configuration and the level of pain is not necessarily correlated, so who knows what's really worse. I certainly know that both are a problem. I'm not going to leave one just for curiosity. Unless I see something. So I evacuated all the loose pieces that went all the way across. Make sure the dural tube is intact. That's a blood vessel. There's the dural tube. I kept the epinurium intact so that its blood supply is not disrupted. I bet you it will start pulsating. There it is. Yep, there it is. It's creepy when it does that. Yes, one of the poke holes goes right through the tattoo, but I have it in my mind that you're not going to be able to even find it. Because like I said, I love tattoos, and I fancy myself one of the best tattoo realignment spine surgeons this side of the Mississippi. What incision over the tattoo? That's where the second incision is. I'm hoping you're going to be like, where? Where's the second incision? Right there. I don't see it. Exactly. Surgery's all done. I'm going to put a Band-Aid there too because I can't see the incision, but it's in there. And this is the nicest Band-Aid you could buy anywhere. It just so happens that we have it here. And I noticed little things like that, and the surgery went absolutely beautifully. We're all expecting a great result and praying for a speedy recovery, so best wishes.